Now, migraine headaches are the most common neurological condition in the world, affecting an estimated 500,000 people in Ireland alone.
And last week, the Irish Pharmacy Union called for migraine medicine to be made available over the counter, just like it is in the UK, because they say it'll allow sufferers to access appropriate and effective treatment from their pharmacist without delay. Joining us now to discuss this is renowned neurologist and Associate Professor of Neurology at the Harvard Medical School, Dr. Elizabeth Loder. Elizabeth, for people who have never suffered a migraine, can you give us a sense of how it is more than just your average headache?
Yes, well, you're right to say that it's much more than just an average or even a severe headache. Migraine is associated not only with a very severe throbbing headache that's often, although not always, on one side of the head, usually over the temple area, but in addition to that severe pain, people often experience other symptoms like nausea, vomiting, sensitivity to light or noise, and this can go on if it's not treated or if treatment is not successful for up to 2 days or sometimes even longer.
What's happening in the brain when you're getting a migraine?
Well, that's a good question, and that's what every patient that I see wants to know. We don't have a good understanding of exactly what it is that makes people prone to headache. But one way to think about it is that people who have migraine have inherited, it is a genetically influenced illness, have inherited a central nervous system and a brain that's very, very susceptible and sensitive to any information coming in from the outside. And so when there's sensory overload or other things going on, the brain responds by having a migraine. It's very easy in people who have a tendency to experience migraine headaches to set off that chain of events that culminates in a bad headache.
So if somebody in your family had it, you're more likely to suffer with it yourself?
That's exactly right. You've inherited a nervous system that's very susceptible to migraine attacks.
And sufferers tend to attribute it to certain things, certain foods or tiredness. Is there a cause and effect with those kind of factors?
Well, for most people who have migraine, there are things that they can identify that move them closer to having an attack, and we call those triggers or aggravating factors. It's very important for people who are prone to migraine to pay attention to the things that might make it easier for an attack to occur. But I think it's also important to realize that for many people, doing that will not gain control of every headache, and some people do need treatment, medical treatment or medications that can be available from physicians.
There are lots of different types of migraines, aren't there?
That's right. About 20% of people who have migraine experience aura before their headaches. Not everyone who has migraine has aura.
Just explain what aura is.
Well, aura is a neurologic event that usually precedes the headache. It typically is temporary and fades away as the headache begins. So a common sort of aura, the most common sort of aura, for example, is a visual abnormality, either losing vision temporarily or having visual abnormalities, seeing squiggly lines or things like that. And it's a warning that the headache is about to begin.
And once you begin to get that, you would know that's it, I'm on a path off which I cannot get.
Well, for some people the headache doesn't necessarily follow the aura, but in most cases you are going to have a bad headache after the aura occurs, so it can be a warning sign that an attack is imminent.
Okay, let's talk about treatment. I mean, we've known about migraines for quite some time, yet we don't seem to have a really good handle on it with the drugs. Or am I incorrect in saying that?
Well, you're partially correct. So there's good news and bad news. The good news is that for treatment of individual attacks, we do have a highly effective category of medications known as the triptans, what the Pharmacy Union is calling for to be made available over the counter. But they don't work for everybody, and one of the cruel paradoxes is that if they're taken too frequently, like many treatments that are used to treat individual attacks, they can actually make things worse over time. So for people who have very frequent attacks of migraine, you're exactly right. We do, in some cases, not have ideal treatments available. Although, that being said, we have a fair number of medications that can be given on a daily basis and some non-drug treatments that can be used on a daily basis to cut down the number of attacks that they have. But further research is definitely needed.
What about alternative therapies? Because a lot of people who do suffer with migraines swear by acupuncture or whatever it is. I mean, you've suffered with migraines yourself, so would you hold, I know you're you're interested in clinical medical results and experiences for people, but in your own experience, you know, do you think there's any you know, positive outcome to be had by trying these alternative therapies?
Well, I have many patients who feel that they benefit from alternative therapies, and some things that are considered to be alternative actually have a fair amount of evidence behind them. So relaxation strategies or other things like biofeedback-assisted relaxation have been studied and are quite effective in cutting down on
biofeedback-related relaxation?
So it's a method of teaching people to relax using feedback. For example, measuring finger temperature or muscle tension and teaching them what they need to do to either raise their finger temperature or reduce muscle tension, which are associated with states of relaxation that can help prevent or reduce the number of headaches people have.
Do your fingers get hotter or colder as you relax?
Warmer. Yes. So, you know, if people are nervous and you shake their hand is often very cold or clammy. So those kinds of treatments work very well in conjunction with medication for a lot of people. There's some synergy when you use them together.
And we were chatting in the break before we came on air about the fact that a lot more women will suffer with migraines than men, which leads to men being misdiagnosed or not diagnosed.
That's right, and I'm glad you said that, because migraine is much more common in women, but it's important not to lose sight of the fact that it's also very common in men. So very well done studies show that over a lifetime, about 43% of women and roughly 18% of men can expect to have a migraine attack. That doesn't mean they all have them regularly or are disabled, but it's an extremely common illness. It's one of the top causes of disability. And looked at another way, what that means is that about 1 in every 2 women and 1 in every 5 men can expect to have migraine at some point over a lifetime.
And is migraine sufficiently severe? You know the way you will hear people say, oh God, I'm having a migraine, and then they continue to go to work and go about their business. Is it bad enough that you know the difference between it and a very bad headache?
Yes, I think so. And it's unfortunate that the term migraine is sometimes used to refer to things that are unpleasant. It's a stigmatized illness when you think about it. A lot of people who have migraine really don't want to let other people know that they have the disorder. Even though it's a common cause of missed work, for example, I think there are many people who don't admit that they missed work because they had a migraine.
Why? Because they don't feel like it's a valid reason for not being in work.
I think that's right. Migraine, the hallmark of migraine is pain, and that's a subjective symptom that can't be verified. And I think migraine, like other painful disorders, is somewhat stigmatized for that reason. And that has translated, I believe, into less appreciation for the importance of the illness and less research funding, unfortunately. So things like the Migraine Association of Ireland, for example, I'm here to celebrate their 20th anniversary. It's a patient-led volunteer organization, and they are very important in helping to raise awareness of the disorder, and beyond that, providing support and information to people who have the disorder. Because it is a chronic illness, some people with the disorder, most people with the disorder, must self-manage in between attacks. They can seek medical advice, but they're on their own often in dealing with symptoms.
Although it's a chronic illness with some reason for optimism. You were saying before we came on air that as you age, the symptoms self-alleviate to some extent.
Yes, although it's a very common cause of disability in middle life, it happens to be most severe for both men and women just at the time when they're trying to establish a career and raise a family. So although it packs a big disability punch, it is a condition that often improves over time, unlike most other neurological conditions. So it's not, for most people, a progressive condition, and there's reason for optimism.
Elizabeth, thank you very much. Very, very interesting indeed. And of course, people can contact. What's the website actually for the Irish?
It's migraine.ie, and I encourage people to go there. Lots of useful information, migraine diaries, and all sorts of other things.
Maybe we as well, if we don't suffer from migraines, should be more understanding of those who do.
I'd like to think that most people would be more
well,
understanding.
Well, if you were saying, like, if a family member, and my mother suffers with them dreadfully, it's so debilitating. I mean, she just has to go and lock herself away in a dark room for a couple of days, that's it.
Yes, and I have many patients who say, I don't want to be like my mother, and they seek treatment for that reason. Thanks so much for paying attention to it.
Thank you very much.